Chapter 8: Insulin Administration. In this chapter, we are going to discuss the different ways of administering insulin. We will be discussing injection sites, syringes, insulin pens, and pumps. If you make use of an insulin pump, you should be comfortable using any of the other methods in case of an insulin pump failure or damage. There are several injection sites on the body that can be used. These sites should be rotated often to avoid hard lumps or extra fat deposits developing. These lumps can change the way insulin is absorbed in the body, making it more difficult to maintain a stable blood sugar. The most common injection sites are the abdomen, thighs, buttocks, and the back of the upper arm. The preferred site for insulin injection is the abdomen. Insulin is absorbed more quickly and predictably there, and this part of the body is also easy to reach. Select a site between the bottom of the ribs and belt line, steering clear of the 2-inch area surrounding the navel. You also want to avoid areas around scars, moles, or skin blemishes. These can interfere with the way the body absorbs insulin. And also stay clear of broken blood vessels and varicose veins as well. You can also use the fatty area on the back of your arm. This is the area between the shoulder and the elbow. Insulin can be injected into the top and outer areas of the thighs, about 4 inches down from the top of the leg and 4 inches up from the knee. When the buttocks are injected, it should be done on the upper outer areas. Using the syringe. The insulin syringe is the most common insulin delivery method. These syringes are available in 4 sizes and has a hold capacity of 25, 30, 50, or 100 units of insulin. When insulin is injected, it is injected into the layer of fat just under the skin. It is not injected into the muscle. Before injecting insulin, be sure to check its expiry date and quality. If it was refrigerated, allow your insulin to come to room temperature. If the insulin is a mixed insulin, like NPH, that is cloudy, roll the vial between your hands for a few seconds. Be careful not to shake the vial, as this will cause the insulin to become full of bubbles. Short-acting insulin that isn't mixed with other insulin shouldn't be cloudy. Don't use insulin that is grainy, thickened, or discolored, and always check the expiration date. If you store insulin, always store it in a fridge. If you use a vial in a pen, then it is okay for it to be stored at room temperature, but the manufacturers recommend the vial be replaced after 28 days of use. Before injecting insulin, gather all your supplies: medication vial, needles and syringes, alcohol pads, and a puncture-resistant sharps container for proper needle and syringe disposal. Wash your hands thoroughly with soap and warm water. Be sure to wash the backs of your hands, between your fingers and under your fingernails. Remove the cap from the insulin vial and wipe the stopper on top with an alcohol swab. Remove the protective cap from the needle. Hold the syringe upright with the needle on top and pull the plunger down until the tip of the plunger reaches the measurement equal to the dose you plan to inject. Holding the insulin vial firmly on a flat surface, push the needle into the stopper and push the plunger down so that the air in the syringe goes into the bottle. The air replaces the amount of insulin you will withdraw from the vial. Keeping the needle in the vial, turn the vial upside down. Pull the plunger down until the top of the black plunger reaches the correct dosage on the syringe. If there are bubbles in the syringe, tap it gently so the bubbles rise to the top. Push the syringe to release the bubbles back into the vial. Pull the plunger down again until you reach the correct dose. Set the insulin vial down and hold the syringe as you would a dart, with your finger off of the plunger and remove from the vial. Swab the injection site with an alcohol pad. Allow it to air dry for a few minutes before inserting the needle, as the alcohol will sting. To avoid injecting into the muscle, gently pinch a 1 to 2 inch portion of skin. Insert the needle at a 90-degree angle. Push the plunger all the way down and wait for 5 seconds. Release the pinched skin immediately after you've pushed the plunger down and remove the needle. Don't rub the injection site. You may notice minor bleeding after the injection. If so, apply light pressure to the area with gauze. After you are done, place the used needle and syringe in the puncture-resistant sharps container. Insulin pens. Insulin pens make the injection process easier for many patients. Although there are many different types and brands, these pens allow for easier and more accurate insulin administration. When using insulin pens, wash your hands and pick an injection site. It's a good idea to write down where you inject each time in a place that's convenient for quick reference in order to avoid a buildup of scar tissue. If the insulin you're delivering is mixed, roll the pen between your palms and then hold the pen vertically and tip it upside down several times to thoroughly mix it. Do not shake the pen. Take the cap off of the insulin pen and wipe off the rubber seal that sits above the insulin reservoir with an alcohol swab too. Take a needle and remove the plastic covering on the base. There are various lengths of needles. This will be prescribed by your doctor. Align the base of the needle onto the pen and twist it until it sits snugly on there, but not too tightly. Then remove the protective cap from the needle itself. Prime the pen by setting the pen to 2 units. With the pen pointing upwards, press the button at the end of the pen. You should see insulin coming out of the needle of the pen. This means the pen is primed and ready for injection. Clean the injection site with an alcohol swab and allow to dry. Calculate the insulin dose and dial the amount on the pen. With one hand, pinch the skin around the injection spot so that the insulin can enter the body subcutaneously. Use the other hand to hold the pen and firmly insert the needle into your skin. The angle of insertion depends on the needle length and the amount of fat that can be pinched to protect the muscle underneath. Ask the doctor what angle is the best for your body. Once the needle is completely inserted, press the button all the way down. Count to 10 seconds before taking the needle out. Check for any bleeding and gently apply gauze and clean if needed. Needles are single use, so place the plastic cap back on and twist counterclockwise to remove the needle from the pen. Dispose of the needles in a sharps container. Replace the pen cap back on and store in a safe place. Lastly, we will be looking at continuous subcutaneous insulin infusion (CSII) devices, also known as insulin pumps. These pumps are the most sophisticated form of insulin delivery. These are small, computerized devices that are programmed to deliver insulin under the skin. The insulin pump is durable and lasts for years, but every few days you should change the insulin supply and certain pump components. There are 2 different types of pumps: traditional and patch pumps. Traditional pumps have an insulin reservoir and attached to the body with tubing and an infusion set. The buttons on the pump allows you to program bolus insulin for meals, basal rates for insulin delivery throughout the day, and to suspend insulin delivery if necessary. Patch pumps have a reservoir, pump, and infusion set inside a small cast that are worn directly on the body. These pumps are controlled wirelessly by a separate device for basal rates and bolus insulin. Some of these pumps connect with glucose meters wirelessly or interface directly with certain CGMs. To use an insulin pump, it is imperative to get hands-on training from your doctor or diabetes care team. You will learn how to refill the reservoir, prime the pump, select an infusion site, change the infusion set, calculate basal rates, troubleshooting, and create backup plans should the pump fail. At the end of this chapter, we will post links to resources that will help you better understand insulin administration. In the next chapter, we will look at the insulin to carbohydrate ratio and the correction factor.